1.
Do you know that nearly 40% of Americans have at one point delayed seeking medical attention due to high costs? If the answer is no, then you're like me. Many people are aware of the broken healthcare system that we have in the US, but they don't really know exactly how bad it is. According to psychocare.org, 1 in 3 Americans say that financial concerns prevent them from getting checkups or visiting the doctor. This is especially concerning because checkups are essential for the early prevention of illnesses. Not too long ago, I had a friend with stomach problems who underwent some tests and a procedure. Due to the lack of insurance, he had to pay around $8,000 in total. As a result of this, he had to drop out of college and work several months to pay the debt. This is just a minor example of how the high cost of healthcare can impact your everyday life. The rising cost of healthcare in America should be examined because it affects families, individuals, and businesses. In this speech, I will be discussing the high cost of healthcare, the causes of the issue, some possible solutions, and the opposing argument. First, I will be informing you about the current social issue of unaffordable healthcare. The US has been facing the issue of unaffordable healthcare for quite some time now. According to a 2021 survey by Westhelp and Gallup, 18% of US adults say that they cannot afford quality medical care. In addition, Black adults, 29%, and Hispanic adults, 21%, say that experience higher healthcare unaffordability than white adults at 16%. Notably, this data shows that people of color are more likely to be affected by the high cost of healthcare in comparison to their white counterparts. The study conducted by Westhelp and Gallup also showed that in the past 12 months, 18% of respondents had to skip care they needed due to cost reasons. Next, I will discuss some of the causes that contribute to the high cost of healthcare in America. Some of the major factors that contribute to the high cost of healthcare in America include an aging population and insurance companies. According to a US Census Bureau, the number of Americans aged 65 and older will reach nearly 25% by 2060. This means that more people will enroll in Medicare than ever before. Medicare is a federal government program, so an increase in enrollment will affect national healthcare costs. The CMS estimates that medical costs will rise by 7.6% every year until 2028 to meet the growing number of beneficiaries. Insurance companies also play a big factor in the high cost of healthcare. Health insurance companies, as well as Medicare, pay hospitals, doctors, and medical providers on a fee-for-service basis. As a result, they receive more money for services they provide. Um, Overtreatment, overprescribing, and redundant testing can result from this, especially in patients with low potential for improved health. In addition, the U.S. doesn't have an integrated health system. According to the World Health Organization, integrated care is a strategy to deliver health services in a way that is user-friendly, result-oriented, and cost-effective. The lack of, of coordination in an unintegrated health system can result in patients receiving duplicate tests and paying for unnecessary procedures. Next, I will discuss some of the causes that contribute to the high. Next, I will discuss some of the solutions to reduce the high cost of healthcare in America. One way to solve the rise of healthcare costs due to the aging population could be to implement an integrated health system. Another way to reduce costs is to encourage competition among hospitals and healthcare providers. The implementation of an integrated health system can help reduce unnecessary spending in healthcare systems and increase cost effectiveness. According to a recent study done by Sweat Pay, analyzing the economic burden of patients with chronic illnesses, found that health integrated health services significantly contributed to reducing overall costs on patients with chronic illnesses. Another way to reduce costs is to encourage competition. According to Proper and Sunderland, pro-competitive reforms in the UK resulted in lower healthcare costs in the 1990s. Moreover, competition can help to ensure that healthcare providers are held accountable for providing quality care. Lastly, I will discuss the opposing side of my argument. The opposing argument for reducing the cost of healthcare in America is that reducing the cost will lead to an increase in taxes for lower and middle income individuals instead of the wealthy. In fact, this is not true. Germany, for example, in Germany, for example, income-based premiums are charged based on income level, with people with higher income paying more and funding the programs for those at lower incomes. As a result, um, families in lower and middle income levels pay less in medical costs. The only problem with the system is that it may not be supported under the Commerce Clause in the United States. So the other alternative would be to expand Medicare. Like in Germany's system, Medicare covers all its citizens, regardless of income, through its various parts. According to Michael Supanik, the expansion of Medicare provides the best solution as it is a constitutional policy that meets the needs of all public. I just finished discussing my main points about healthcare costs. Now I will conclude my speech. The rising cost of healthcare in America should be examined because it affects families, businesses, and individuals. In this speech, I went over the high cost of healthcare, the cause of the issue, some possible solutions, and the opposing argument. If you would like to help reduce the cost of healthcare in America, then one of the things you can do is to advocate for policies that promote transparency and accountability in healthcare pricing. Additionally, supporting initiatives that focus on preventive care and promoting healthy lifestyles can help alleviate the burden of healthcare costs on the overall system. Reducing the cost of healthcare not only benefits individuals by making it more accessible and affordable, it also benefits society as well. Thank you.